What exactly OCD is? An individual with OCD had frequent, upsetting thoughts, obsessions, that she tries to control by repeating particular behaviors, compulsions. The obsessions spark a great deal of anxiety, because they are not only intrusive and unwanted, but also recurrent. People with OCD will do anything to combat or escape the obsessions, and therefore they resort to extensive compulsions and avoidance. OCD is a disorder defined as the presence of an obsession, an irrational thought or idea that continually repeats, or a compulsion, an irrational behavior performed repeatedly. These behaviors can occur together or on their own, and interfere with a person's quality of life and ability to function. OCD is significantly different and is characterized by more specific problems such as repetitive hand washing, locking and unlocking doors, the need to have everything clean and orderly, and intrusive thoughts. Usually, OCD affects all aspects of life, making work, school or healthy relationships impossible. OCPD could relate to improved performance at work or school, but relationships with other people are likely to suffer. People with OCPD, on the other hand, have issues that affect the entire personality. And this can have a more devastating impact on relationships. People with OCPD tend to be good at delaying gratification, often too good. Those with OCD are aware that their obsessions are unreasonable, and they can feel tortured by both the obsessions and compulsive behavior. Typically, OCD starts to develop in later childhood or during adolescence when symptoms can wax and wane, with symptoms getting better at times and worse at others. It's not typical for OCD to start later in life. OCD tends to be distressing because the person may realize that her symptoms are impairing her life but still feels compelled to do her compulsions. OCPD is a personality disorder marked by perfectionism and a need for control. OCD is characterized by obsessions and compulsions that take up a lot of time. People with OCD are usually self-aware, but people with OCPD typically are not. The prognosis is generally better for OCD than OCPD, but both conditions improve with treatment. Treatment for both OCPD and OCD can involve psychotherapy. Critical elements in differentiating OCPD versus OCD are the obsessions and compulsions. A person with OCPD will have some rigid behaviors, but they will not engage in the overwhelming need for repetition linked to OCD compulsions. Another basis for determining OCD versus OCPD is the level of insight and self-awareness. Most often, a person is fully aware of OCD and the problems it causes, but OCPD is different. A person with OCPD usually believes their thoughts and behaviors are normal, and other people are the ones who need to change. Treatment for OCD selective serotonin reuptake inhibitors, SSRIs, are commonly used in the treatment of OCD. The most effective form of psychotherapy for OCD is a type of cognitive behavioral therapy, CBT, called exposure in response prevention. In this form of therapy, the patient works closely with the therapist to gradually approach a situation that the patient finds terrifying, and then the patient learns to cope with their anxiety without relying on their compulsions or avoidance. Touching surfaces in a public restroom and then not washing is an example. The goal of this treatment is not to limit having the intrusive thoughts, but instead to learn, over time, to be open to them and not react to them in fear. Both in session and through homework assignments, the person learns to notice and acknowledge the intrusive thoughts without responding with compulsions, and, through this process, the person reclaims her life since her routine and functioning are no longer disrupted. Individuals with OCPD tend to think their way of doing things is the right and best way, and they are fixated with following set procedures or routines in their work or daily living, even when these routines are inefficient. These individuals tend to be overly controlling of their environments or relationships, wanting others to conform to the strict rules they set. A person with OCPD has an overwhelming need for order, a strong sense of how things should be done, and a rigidity when it comes to following rules. A person with OCPD can be successful in work life. For someone with OCPD, it's all about rules and orderliness. The person believes there is a certain right way of doing things, and that is how things should be done even at the expense of relationships. Is there medication for OCPD? Symptoms of OCPD are, let's suppose in general, if you suffer from it, you will be overly concerned with orderliness, perfectionism, and control in every aspect of your life. You may see the way you approach things as the best way, while others around you believe you're difficult to communicate with. Though prescribers and researchers have attempted to limit the symptoms of OCPD with multiple medications including benzodiazepines, stimulants and antipsychotics, no one type of drug has shown exceptional effectiveness. Currently, experts believe antidepressants and anticonvulsants may offer the most benefit. The treatments for OCPD are very similar to those for OCD, with the treatment found to be the most effective being a talking therapy called cognitive behavioral therapy, CBT. Some people find CBT can be effective for treating OCPD because it targets the individual's quest for perfectionism and rigidity in thinking and helps focus on the stress that is causing the need to be perfect and organized. It helps the person identify the distress that is driving her to be so perfect and organized. CBT also helps the person to identify the unattainable standards and rigid rules they are living by and to understand how these things get in their way. I work with patients to test these standards and rules so that they can come up with more flexible and time-efficient ways of living. In the process, we also aim to reduce self-criticism and broaden how the person evaluates herself to be based on various life areas rather than being just based on achievement.